everyone. Today we are going to be discussing on a very important topic, that is bronchiolitis. So this is equally important for your exams and your clinical practice. So this topic would cover a few points. Firstly, definition, then etiology, pathophysiology, clinical features, diagnosis and management. Okay, so here we go. Firstly, the bronchioles, the normal respiratory anatomy, right? So the bronchioles are the smallest airways before the alveoli. They don't contain, so they don't have cartilage, and they are usually lined up with an epithelial cells that sweeps the mucus upwards, and air goes in and out easily when the lumen is open. So now what is bronchiolitis? It's an acute inflammation of the bronchioles due to the virus. So there are many viruses which affect the bronchioles. Mainly, the most common virus which affects the bronchioles is respiratory syncytial virus. Okay, respiratory syncytial virus. This is the most common pathogen virus which affects the respiratory system. There are many other viruses also, like parainfluenza virus, adenovirus, metapneumovirus. Now, in which age group do you find this? So it basically affects less than 2 years and peaks between 3 to 6 months of age group. Okay, so peaks between 3 to 6 months, and it usually affects the patients, that is the children who are less than 2 years of age. Now, when does this happen? It happens during winter season. There are high chances of seeing respiratory, this RSV infection during winter season. Now, we'll be moving on to pathophysiology of this. Okay, just a moment. Okay. So, now what we're going to see is how does this affect our system, our respiratory system. Now, I'm very sorry for the drawing. I'm not that great with the drawing here. So, this is a person. Okay, now when that person inhales this respiratory syncytial virus, this can either spread, it's an airborne disease, or it can spread through droplets, tiny droplets from an infected person. Now, when it enters the nasal passage, okay, it goes into the upper respiratory tract. That is, it goes into the nasopharynx, then it goes into trachea, then it goes down into the lower respiratory tract, and there it enters into the lower respiratory tracts, goes and enters into the bronchioles. These are the bronchioles. Okay, now what happens in this situation? Okay, so the virus infects the upper respiratory tract, then goes down to the lower respiratory tract, and then into the bronchioles. So here these bronchioles contains the epithelial cells which gets damaged, okay, and then it sloughs off and falls into the lumen. So now when the body reacts, okay, it causes an inflammatory reaction. So it affects, this RSV affects the bronchial epithelium. It causes an inflammatory reaction, and here it leads to edema and mucus secretion and infiltration with inflammatory cells. Okay, and thereby what happens is, here this is a normal bronchiole. Okay, normal bronchiole. Normal wall of the bronchiole contains. Now here what happens, the bronchiolar wall becomes thick and then it becomes narrowed. Now think of, you can imagine thick syrup going through a thin straw, like it goes through a thin straw. What happens is, you can imagine pouring a sticky syrup and got into a thin straw, and here what happens, the airflow here, it becomes very difficult. Now because this airway is so swollen because of the inflammation, here inflammatory reaction happens, then it gets infiltrated with lot of inflammatory markers, it causes edema, then necrosis. So now when the airway is now big swollen, it gets blocked with a mucus plug over here. Okay, mucus plug is a combination, it's a mixture of mucus and cellular debris. Okay, it forms a mucus plug. So this mucus plug, it gets blocked, the airway now becomes swollen and it is blocked with this mucus plug. Okay, so airflow becomes very uneven. During inspiration, airways open a little and then the air enters. Okay, and during expiration, airway collapses and air gets trapped inside this. Okay, So airway trapping leads to hyperinflation of the lungs. So some alveoli will not get air at all. Okay, and this will lead to collapse. Now here what happens is, when there is a mucus plug formation, there is air trapping inside the bronchiole. This air gets trapped. Okay, then what happens is airway trapping, meaning oxygen is inhaled but it gets trapped. So what happens is there is hyperinfiltration and hyperinflation of the airway. This will lead to air trapping causes over distension of the lungs. Okay, and it leads to airway obstruction. So airway obstruction means what happens is there is poor ventilation in the parts. This will leads to decrease in oxygen levels and increase in carbon dioxide. Okay, so what happens if there is a poor ventilation in certain parts? It will lead to VQ mismatch, and this would eventually lead to decrease in oxygen supply and increase in CO2. So it means it will lead to hypoxemia and hypercapnia.